In this video, a leading prosthodontist from Costa Rica explains immediate load dental implants. He also discusses who's a good candidate for immediate load implants.
It's sometimes called same-day implant as well, which is a misconception of the name, but they're actually the same thing. In which you would place the implant, you will do the surgical procedure for the placement of the implant, and within the same week where the patient is here, they will also receive a crown on top of that implant. Most of the times, that crown is made of a temporary material, an acrylic material, or sometimes it can also be done with a permanent porcelain crown on top. As with any other implant, this could be done with a single implant, with 2 implants, 3 implants, or with a full mouth set of implants. What's most important out of the immediate load that people need to know is that it works, is that it's something that we're doing on an everyday basis, but that it's not for everyone. And we're going to discuss why it's not for everyone. People need to know that just because a friend got it done, that doesn't mean that maybe they can have it done also. It depends. It is very important, the bone height, the quality of the bone. We have 4 different types of bones within the mouth. The first being the poorest, and the last one being with the best quality. The best quality because it's a bone that is it's harder, it's more stiff, and it also has more blood irrigation. So a patient that has a great bone height, a very good or the top quality of bone, a patient that has never smoked in their life or is not smoking now, that's obviously a very good candidate for immediate load. A patient that smokes, a patient with poor bone height, with poor bone quality, it's obviously a patient where we wouldn't recommend immediate load because the risks are so high. The success rate of a traditional implant meaning when you place an implant and you wait 3 or 4 month healing period for the process in which the bone cells and the titanium become one, that has a success rate of over 98%, which means that 98 out of 100 patients, out of 100 implants are successful, which is great. With immediate load, those numbers drop, especially if you're not doing it the way you should do it. Success rate with immediate load, when you know what you're doing, should be around 85 to 90%. Okay, the numbers drop a little bit, but it's still enough good success for you to risk it and do it. If you start compromising and doing immediate loads in patients where the bone quality was not the best, where the bone height was not the best, or the overall conditions of the patient, for example, being a smoker, are involved, then your numbers will drop, and will drop dramatically. They will drop anywhere to 70% and lower. Okay, it's a procedure that we do very often. It's a great procedure. It saves time. It will prevent the patient from having to do a second trip. But if the case is not the best, if you don't select the patient properly, then you can start having problems. So any of both procedures are great. Selection of the patient is what's most important.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.